Welcome to the Survivors to Thrivers podcast. My name is Joshua Blatman, and on the podcast today we have Dr. Hal Blatman. He is actually my father, and he has a pretty extensive skill set in the medical field, trained as an orthopedic surgeon, and who kind of rewrote his career into chronic fatigue and fibromyalgia care in his own practice in Cincinnati, Ohio, since 1988. And I was really looking forward to having you, Hal, on this podcast because you have a pretty extensive skill set and experience in dealing with pain and helping release people from pain. This podcast is ultimately about soul and how do people and healing the facade that we kind of put forth, so that we can ultimately, get more in touch with who we are and, stop suffering and help people get out of pain and into freedom from pain. And I thought, I really appreciate that you decided to come on to this, that you're willing to come on to this recording here, this show here with me. And man, I think I'll just let it open with that and see what you have to say to start out with. We can kind of see where things go.
Thanks, Josh. Thanks very much for having me aboard to enjoy this conversation. Healing the facade takes so many levels. When we talk about people in pain, there's no face for the person in chronic pain that describes what they go through and what they feel, and they're always putting up some sort of facade. In acute pain and you just banged yourself with a hammer or somebody stepped on your foot, there's all kinds of expressions that come to one's face and maybe even words that comes to one's lips. But not the same with chronic pain, and yet someone with chronic pain still might go to a comedy club and laugh, but they're still miserable with pain, and that part is always, to some extent, perhaps a facade. So we can release and help people deal with all these issues. We can help people stop their suffering. So many people who have had pain for years have been taught that there really isn't anything they can do but suffer, and the entire model by which we treat pain around the world even needs to be rethought.
There's a lot there. How we treat pain around the world.
Well, let's talk first about how pain is considered around the world. There's been definitions of chronic pain, stuffed shortly saying it's an unpleasant sensation. But the issue of chronic pain is that everyone agrees that there's an acute injury that develops or brings this on, and that acute injury brings acute pain. And then the consensus around the world is that if that acute pain isn't healed in the first 3 to 6 months, it magically transforms to chronic pain, which can never be made to go away.
That seems like a cop-out.
Well, I think that it's based on an idea that pain has sources that are not understood by medicine, not understood by your therapist. They don't show up on an MRI, they don't show up on a CT scan. You end up continuing to have pain, and so the issue of intractable chronic pain is pain that is outside the what would be expected from the physical and test findings that can be discovered in figuring out your problem. And you still have this pain and disability from it, but it can't be found. And if the source can't be found, there's really no way to treat it except to make the brain not work or the nervous system not work, or to put numbing medicine in, or to numb the brain, or really that's all we've got.
Can you mention, and can I follow up real quick?
Everything else is coping skills. And the work that's done where the injury is actually work of healing. And that's what we really can focus on.
Yeah, because it seems like what's happening like I see the process happening, and I've seen the process, you know, being in your space for all these years, like, but just like the way you tell me that story and what comes up for me in that is that, you know, that cop out idea of a person comes in with pain and they run all the tests, whoever the, you know, the medical expert is, the professional, runs all the tests they have, and all the tests that exist come back indicating some sort of negative. Therefore, the only logical conclusion is that the pain that the person is coming in with and reporting is fake, is made up, and therefore deny
Well,
what you don't have evidence
that's not
for.
so much the issue. I mean, certainly that exists, and it also exists that there are people that will claim to have pain so that they can get the benefit of the medication that
Right.
could be thereby prescribed. But that's not what we're talking about.
Sure.
Let's go back to the original piece,
Yeah.
where I said the prevailing view in medicine is that if pain lasts more than 3 to 6 months, it becomes this issue of chronic pain. What we've found is that that's not consistent with our biology. What really happens is that we have an acute injury that gives us pain right afterwards. But there's no, this whole conversion or transformation from acute to chronic pain is totally artificial. And really, the real world is that once we have pain, we will continue to experience some evolution of that pain until the injuries sustained that cause that pain are healed, and then that pain goes away.
I've heard of
that. At
that
that point,
yeah.
It doesn't matter whether it's 3 months, 6 months, 10 years, 35 years. If we can find the injuries that were caused, we can help our biology heal from those injuries. And as fast as we do that, we have the opportunity to watch pain go away. And a lot of this people can do themselves.
Oh, that's interesting. The acute pain to chronic pain, like transition that happens somewhere between 3 and 6 months. Like,
that's totally artificial.
Okay.
It's totally artificial, and it's based on the idea that the body does most of its healing in 6 to 8 weeks. It really does. Does most of its healing in that time period. If we have an injury that persists beyond that time period, the body has no way to know that it did an incomplete job with the healing.
Oh.
The body's pretty much done. When you skin your knee and you grow a scab, that scab falls off in 4 weeks. You have new skin underneath. Your body's not quite done because the skin's still pink, and then it changes color and becomes more the normal color over the next few weeks. And that's the healing process mostly finished. There's some modification that comes on in the next several months, but by and large, that's already done. So let's say you have a partially torn rotator cuff tendon. The reason that tendon is partially torn is because you have injured it many, many times in your lifetime. Your body has run this repaired mechanism many times in your lifetime. But at the end of the day, when all's said and done, your body's done an incomplete job.
That when the programs,
exactly.
Yeah, I think
so.
Okay.
We go ahead and finish. The body finishes doing its repair program. It has no idea it's done an incomplete job. You still have the pain and discomfort. So where do these injuries come from? Why do they cause pain? Where does the pain come from? How do we find it out? Those are all the issues that we teach, that we've found so successful in helping people really and truly get out of pain by healing the injuries. And then it's not a matter of how long does it last. It lasts until you get hurt again or do something that hurts you.
You mean how long does the healing last?
Yeah. How long does the pain relief last?
Right, because at that stage, it's not about pain relief. It's about fundamental healing, pain being the symptom of the pain being the symptom of the, whatever the word is for discomfort or lack of homeostasis,
Correct.
for dishealth.
So when we talk about injuries and we talk about pain, everyone who has sustained a trauma has sustained an injury. Let's say, for the sake of argument, that the only trauma we sustained was mental.
Okay.
We were put down, abused, but our abuse was mental. Don't think for a second that the memory of what went on in your head isn't maintained in the fascia of your body, for your fascia to be abnormal and your fascia to cause you pain.
Yeah, fascia
You
is
can't
such a
separate that.
fascinating topic that is really poorly understood as far as I've seen. Can you tell me a little more about fascia, how pain stays in fascia, why it can't be seen by current medical equipment, how to find the pain in the fascia, how to release pain from fascia? Can I just give you like a 3-minute platform to talk about that?
Well, it may take a little longer than 3 minutes, but
Whatever you need.
essentially, this is what holds our body together. So if you pull a steak apart, the thin film between the fibers is the fascia that surrounds every muscle cell, every muscle fiber, defines the muscle, goes all through the muscle. And then the thicker parts, called gristle, become tendons and become the part of the fascia that interweaves with the cover over the bone. No tendon attaches to bone. There's a weave.
Oh.
And the fascia is continuous from your head to your toe. So the fascia that goes up your leg from your gastroc muscles interweaves with the fascia that becomes your hamstrings, and also interweaves with the periosteum on the back of your thigh and leg bones to kind of tack in there to make anchor points. But if you bounce real hard on your calf muscles, you'll tear and slip parts of that weave, and then your calf muscles get really tight and develop knots in the fascia strings that we call trigger points. And that's how the primary injuries to the body happen. Well, that fascia that went up your leg and up your thigh goes also through your buttocks and up your back and all the way over the top of your head to your forehead as one continuous string, if you will.
Yeah.
And so if you look at books from Tom Myers, who wrote Anatomy Trains, and you see the videos that were taped by David Lasandak, and read his book, you start to learn how these fascia lines and strings are all over the body in certain patterns that help our body function. We talk about muscle memory, but muscles are not really smart. Muscles just have a switch on and off, and that's all they know to do. And if you get a whole bunch of muscle cells in a row tied together by fascia to switch on at the same time, you can get the muscle to shorten.
Contract.
That's how that contract, exactly. That's how we make movement happen. But the memory of what that muscle did is in the fascia, not in the muscle cell.
Interesting. That brings me full circle back to what you said about injuries that are 10, 20, 30, 40 years old, that you can, through the work that you do, you can like the pain that's been stuck in the body, which one would conclude maybe from what you've just said, that the pain is stuck specifically in the fascia, that you do trigger point. How does that work? You do trigger points into the muscle, but it releases the emotional energy from the fascia?
Yes, it will do that also. So will massage therapy that releases the tension or whatever holds the fascia. Let's get a little more basic though.
Yeah, cool.
When a patient comes to me, a person comes to me and asks, "I hurt, please help."
Basic.
The first, real basic. I'm being asked to play CSI. How to figure out who done it, so to speak. Where does the pain really come from? And lots of other doctors have tried to do it in advance of me for some of these people. They might have been to this big clinic or that big clinic, and they might have had all kinds of MRI and CT scan testing and whatever they've had done.
Especially if we're
pain.
Especially if we're talking about patients from 10, with decades old pain, of course. Totally.
Exactly. And so we're talking basically about if your previous care has really found the source of your pain, then why isn't it gone? So let's play CSI and try and figure out where it comes from, but not by doing the same stuff all over again. You've already done enough of that. That's pretty goofy. It didn't work the first time.
Yeah.
So I have 4 rules that we call the Blatman method of pain CSI. And the Blatman method means, rule number 1, we can't as a person believe that where we think we feel the pain is where the pain comes from. Your headache doesn't come from your head. Your left arm pain could be your heart attack. You have no idea except that your left arm hurts. Why wouldn't that be any different that you should think your low back pain comes from your low back or your foot pain comes from your foot? And I'm here to suggest we cannot believe where we think the pain is, where we feel it is where it comes from. Second, we can't really believe what we think it feels like. If you really analyze your pain and you go spend time talking to your doctor, and is it numb and tender and burning and tingling and sharp, dull, stabbing, aching, and the doctor asks you exhaustingly for the description of what is the pain, and the nurse wants to know too, and everybody writes it down in the chart, and none of it makes a difference.
And you color the pencil, you use the colored pencils to fill in the sheet, and you make your nice little pretty diagram.
And every patient needs to do that in my office at every visit, because I love to see the colors change, because sometimes the colors change before the pain goes away. But I really want people to know it doesn't make any difference. Burning doesn't mean something diagnostically different than aching, than sharp, than achy, than dull, because our brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, and even sexual arousal comes from the same nervous system.
From the same nervous system?
So if you ask some from the same nervous system,
well, there's only one nervous system.
No, let's hold on to that for a minute.
Okay.
Same division, if you will. One nervous system, but this division.
Okay.
So if you really talk to somebody in pain, they might tell you that they experience all those sensations at the same time. Sometimes it's numb and burning, and sometimes aching, and sometimes sharp, and it's all interconnected and the same. And they have difficulty defining it, not for any better reason than the brain has trouble distinguishing those sensations. Now, at the same time we say that, I would like to say that the distribution of where we feel those sensations or think we feel those sensations is absolutely important. But how we interpret them and how our brain interprets them is certainly not of diagnostic consequence. And most of the doctors will think that burning and numbness and tingling means nerve. And let's differentiate that. If your arm is numb and you can't feel it, and your muscle starts to waste away and you get atrophy because the muscle isn't getting a signal from a nerve, that's not what we're talking about here.
Okay.
Okay.
Can you elaborate on that?
No, let's leave that one. Let's leave that one behind, because that's a nerve injury that's going to is probably detectable by an MRI scan and detectable by an EMG.
Okay.
The stuff we're talking about is not.
Okay.
So if you can't believe where you think the pain is, and you can't believe what you think it feels like, rule 3 is what you can believe. And what you can believe is that wherever you are specifically tender, millimeter by millimeter, with a fascia examination of your entire body, the places that are tender are either where your fascia is tied in a knot, we call a trigger point, or where your fascia is injured, where it attaches to you, where the pull came to make the weave slip to cause the downstream trigger point somewhere in the middle of the muscle.
Attaches to you. What do you mean by attaches to you? It's all you.
Well, your biceps muscle has to attach to you, or when you contract it, it wouldn't do anything.
You mean to your bones?
To your bones, but nothing really attaches to bone.
Oh, yeah. Okay. You said this
It,
a long time ago. I remember
it
vaguely,
weaves to the cover over the bone
which is still
and
fascia.
then continues in the next muscle. Correct.
Oh, okay.
And all these trigger points and fascia disturbances through the body come from these injuries of when we pulled harder than we were able to hold ourselves together. We'll get
Like,
to that in just a minute.
yeah.
Like, for
Okay.
example, if you have real tight upper traps,
Mm-hmm.
you use those muscles a lot to carry your book bag, to stand on your hands, to do to pick up a suitcase that was too heavy,
To lift your
or
kids.
all that.
Yeah.
And you're strong enough to contract the muscle, and you're strong enough to pull that hard. But
Uh-huh.
where your strings that hold your muscles together, they weren't all strong enough to handle when you pulled that hard, and they slipped and twisted into these knots that are in your upper traps that if you squeeze on real hard send pain to your head and
Mhm.
cause part of your headache.
Interesting. You
So what
said,
we find is rule 4.
okay.
As we go through the body and find out where you're most tender, rule 4 is that almost always the places where your fascia is injured and tied in knots that are most tender generate most of the pain you think you feel. Not your disc, not your nerve, but the fascia that holds all of you together that's injured. And then rule number 5 is our rule of treatment. If we can help your body heal, even years after injury, the fascia injuries that are part of this in the first place, and those that happen downstream since then, we can get the pain you thought you had to mostly go away. And we find that is our biologic reality.
That's fairly new thinking, isn't that?
It's
That's
an
like,
entirely different paradigm.
it's entirely new
So
paradigm.
rather now than instead of just doing coping skills and mind, body, spirit's important because that's all part of your fascia in some way also,
Right.
you still need to get those injuries to heal. And so we are able to detect where these injuries are by actually the texture of your fascia. I can touch your body and tell you where you're tender, where you're not tender, and we can together decide where are your most significant injuries. Most always, they'll relate to the pain pattern that's most critically in your mind. And then we can talk about the process of healing. And well, healing, we use all kinds of things now that we didn't have before. And we should talk for a few minutes about them. Let's talk first about what people can do themselves. And
Okay.
so these knots that are in the fascia, you're not going to be able to do a whole lot with your hands where the attachments are. You'll rub the bones and the skin and you'll make yourself sore. You'll make a much bigger difference going after where the strings are tied in knots. And you'll find that they're really tender. And when you push on them, they send pain all over. That's great. Push on them again. Because if you push on them and physically make them smaller, as long as they're smaller, they'll make less pain. Whether it's numbness or burning or tingling or aching or sharp or dull, that's what you need to do.
Mm-hmm.
And you're allowed to push as hard as you want, as long as you can fully relax with the discomfort you cause. We call that a good hurt. So we describe how to push on them with a rubber ball. We describe where they are and where their pain patterns go in the book I wrote a few years ago called Winner's Guide to Pain Relief.
Mm-hmm.
And this book can be gotten for any do-it-yourselfer, from headaches to foot pain, show you where the muscles are, where the fascia knots are, where they send pain. And then after you push on them with the ball and make them smaller, gently stretch them out. Don't ever pull and force a stretch. Think about it this way. The new understanding is that the pain's coming from the knot, and you have to make the knot go away, and the knot is in the strings. So if you have a shoelace and you have a knot in the middle of the shoelace, and you go to physical therapy and they tell you to pull on the ends of your strings, is that going to make the knot go away? Or is it going to make it tighter?
I mean, yeah, if it's the right kind of knot, hopefully it would
It's not a slip knot. None of these are
right.
slip knots.
It's not a bow tie.
Which means we have to teach
Okay.
an entirely different way of stretching. It has to be really gentle, or it has to be done from the inside, like we would call Rolfing or myofascial release. And people can learn how to do that themselves.
Mm-hmm.
They can sign on to a webinar that we might have that will teach them how to do it to a specific area of their body. We'll start having that with our website and presentations. And then we in our office can do things to really help the attachments heal and get stronger. If you have a rotator cuff tendon, for example, and that's where your partial tear is, the orthopedic surgeon, and I'm not one, I did 2 years of orthopedic training in a 5-year program, have a great foundation in orthopedic surgery, and a great experience doing orthopedic surgical procedures, but was never an orthopedic surgeon out in the community where I could call myself one.
Okay.
But now we can detect these injuries that you can't see on a CT scan. We know where they're tender, you know where they're tender, and now we can direct your body to heal them. Well, in the past, we've had prolotherapy. And prolotherapy is a way to, you can do it with an acupuncture needle, you can do it with dextrose and Novocaine injections, but you injure the site that has previously been injured with a needle, and that turns on the body's 4 to 8 week healing program. And then if you really want to speed that up and make it way stronger, then instead of using dextrose and Novocaine, you use platelet-rich plasma from your body, which grew you the scab that repaired your knee, or you use stem cells from the liposuction and your abdominal fat. We can use stem cells from your bone marrow. We can also use stem cells from a donated placenta or donated umbilical cord blood. All of these things have tremendous regenerating powers that we use on a daily basis to help people make all kinds of pain issues go away as we regenerate tissue and get the body to heal from these injuries that are sometimes ages old, or in an athlete, maybe just a few days old, but you have to get back on the field of play very, very quickly. These things and techniques will greatly speed your healing and recovery.
There's a lot there. It sounds like you're making a lot of progress. How can you what's your success rate on these techniques?
You know, if you skin your knee and you have and you make a scab, what's the success rate of your body healing that injury?
Depends.
Pretty high, or otherwise you end up bleeding to death, right?
Yeah.
So when we put these body parts into your body, they have to do what they're designed to do. Now the key is, does that needle go in the right place? And does your body have the resources it needs to do its job in the healing? Well, as an integrative medicine physician, an integrative medicine board certified physician, I'm well aware and can help you get your body in the kind of shape it needs to be, teach you what kind of foods you need to not eat, try to change the levels of inflammation in your body so that when your body heals, it forms a mature collagen that isn't going to grow into pain again, rather than a scar tissue collagen. So we in our centers take this different or higher level of care to actually get your body ready and optimize it for what it needs to be able to do this. And we have 3 centers that we work out of. We have our major center and research center in Cincinnati, Ohio. We also have an office in Manhattan, New York, right in the middle of Midtown. I get there about once a month for a few days. And we have a center that's very part-time in Seattle. When I have been able to come last year and again this year to teach the medical students at Fascia, we have an opportunity to see patients there also.
Wow. Can I pull together a couple ideas that a couple different concepts that you started to touch on that I was like, I want to learn about this, I want to learn about that, and just kind of tie those together?
Sure.
You mentioned that fascia generates almost all your pain. I'm particularly interested in the traumatic stress that becomes an existential crisis as it doesn't get treated over years and years and decades, and people identify as themselves through the lens of their pain, which is like chronic existential pain, I guess, for lack of a better way to explain that. How does pain in the fascia help to release, or even is there any kind of correlation between those ideas?
We have oftentimes, I won't say often, enough to notice what we call the phenomenon of somato emotional release, where we'll be releasing a trigger point or have my needle in a particular trigger point, and the patient will relive their automobile accident or relive the situation that brought them into the situation that they're in. That's happens often enough to expect it, to warn patients about it. It doesn't happen by any stretch in every person. And if it happens to you once, it doesn't mean it's going to happen to you again. Okay. But when that does happen, the release and relief are tremendously powerful for the person who's getting rid of this stuff that they've held on to for a long time.
Oof. That's
so
heavy.
it was really helpful for me to have done enough energy healing education to be right with this, to be able to help facilitate this when it comes up, to be able to use some essential oils and herbal medicines afterwards if needed to help a person through this transition. Because this healing that we help people with is a transformation. If I put a needle into a really, really tight muscle and inject what we use to break up that knot and break up that ropey band and make them not be there anymore and stabilize the body so it can have a better chance at hemostasis, that muscle undergoes a transformation in seconds to minutes. And the pain from that muscle stops. That lasts until that muscle tightens back up again. Now, it could tighten up again because its attachment is too weak and you're using the muscle and pulling too hard. But most often it tightens up again because the person is still eating food that's inflammatory to their body and still has toxins and poisons in their body that may be contributing to the problems.
I hear you.
So we deal with this at all those levels. Also, the first visit often has a lot of information about diet and nutrition and what we call the do not eat list.
What's on the do not eat list?
Well, if your listeners would like to get the do not eat list, they can go to our website.
Okay. What's that?
www.blackmanhealthandwellness.com. Everything's spelled out.
Okay.
blackmanhealthandwellness.com. And there's a place to click to sign up for the newsletter and download the do not eat list. And I think we include a do not, a probably okay, and a good to eat list. And this is not necessarily made to treat you. It's made to be medical advice. It's made to be education of what is the list of inflammatory foods that you really should stay away from. What are the list of generically non-inflammatory foods that most people should be able to eat? And I say most people because if we have someone who's really adhering to this list and they're not improving as much as we'd like to see, we'll often discuss some testing that can further identify what their body might not like to eat. And in some people, we've found things like lettuce that you would never suspect causes this person's immune system a problem, and they stop eating the lettuce, and 3 weeks later, they're doing so much better. So this list is a general list that I think is important, species-wide for our population, but not made to be medical advice, made to give you a basic and understanding of the list of inflammatory foods that we should all know. We should all be reading labels. These are so important for being able to take care of ourselves.
And then maybe once you get those major inflammatory foods out of the diet. And if they're still there, if there's still inflammatory tendencies, then the person might be able to better identify the nuances of their own body.
Yes, because as you listen to me, that starts to give you the idea, but really listening to your own body is what I try to teach people, the language the body speaks. For example, how many people wake up in the morning with a stiff neck sometime in their life, and everybody thinks it's the window, the pillow, I slept wrong, whatever.
A cold front.
Exactly.
Yeah.
And the real answer is that you never sleep that wrong. There's an isolated person with really loose ligaments that might. But the average person, you might not sleep well, but you don't sleep wrong enough to wake up in pain. And it's not the window and it's not the pillow. You wake up in pain because of what you ate the night before. And the inflammatory reaction in your fascia locked up your neck and your shoulders and your upper back. And it feels like a pinched nerve. And you go to your doctor, and wasn't your doctor wonderful? In 3 weeks, your pinched nerve is gone. And I'm going to tell you that the inflammatory reaction from the food you ate the night before that caused that stiff neck lasts for 3 weeks. And your doctor didn't make that much of a difference.
That's advice, ideas that might cause some people to go, but wait a second, I love my doctor and my doctor helps me so much.
That's great. Go to your doctor, but pay attention to how you feel and what you ate and learn to listen to your body. So if you wake up with pain you didn't have last night, don't think it's how you bent over to take something out of the refrigerator that threw your back out. What did you eat in the last 24 hours on the do not eat list in unusual concentration, in addition to whatever you might have done yesterday? That's how you listen to your body and where you might find the answer. If you go to bed in pain you didn't have all day long, you didn't have that headache when you woke up today, but you've got it now 3 hours after dinner. What did you eat today that gave you a headache? And sure, you can write it off to stress and boss and a hard work day, but if you really want to know the answer, hold your feet to the floor and look at every ingredient on everything you ate that day and find out what's on your do not eat list. Or you miss it and continue to write it off to the car ride and the window and whatever it is and continue to not figure it out. But if you really want to figure it out, this is the formula that really works.
You mentioned knots in muscle cause pain in fascia. Muscle and fascia are two different things, right?
The fascia holds the muscle cells together and defines the muscle. You won't get a muscle without fascia to hold muscle cells together. You won't get your heart held in place without fascia holding it in place. Fascia holds your intestines in place. Fascia will also keeps your lungs and your liver in place. Before we go, let's also talk about joints.
Okay.
Because some of your listeners are thinking, well, I don't necessarily get headaches. My knee is what really bothers me. My hip really bothers me.
Yeah, I hear that.
Will any of this work for that? And I'll say a couple things. One is that the joint pain rarely comes from the joint. If you have knee pain, don't think for a second that all of the pain you think is in your knee comes from your knee. Remember rule 1. And if you start to think that can't be true, then think about all the people you know who have had total knee operations and their knee still hurts. There's not even a knee in there, and people think the knee still hurts. That's got to help you understand that the knee pain doesn't come from the knee.
Yeah, that makes sense.
So what we'll do is we'll help show you the fascia on the inside of the thigh and the inside of the leg that causes the pain, some of which you could rub out with your hands and make your knee pain go away. Some which requires trigger point and PRP injections. But let's talk for a second about the person who has joint dysfunction and arthritis, and the joint cartilage is wearing out.
Okay.
So that joint cartilage is wearing out faster than all the other joint cartilages in your body probably because it's been traumatized in the past and can't hold up as well to daily wear and tear. And the reason your other joints are holding up well is because your body's able to repair daily wear and tear as fast as daily wear and tear wears you out.
That makes sense.
That's an important concept because the orthopedic textbooks say that you're born with a certain amount of cartilage, you have that to use up through your lifetime, and once you use that up, you're done. And you wear out and you now get your new joint. And that doesn't make any sense to me, and that's not the way our body works.
It implies that the body doesn't heal itself and that the body isn't
Correct.
constantly in regeneration.
Exactly. So we grow cartilage in every joint in our body every minute of every day. If we're going to repair a joint, first we have to balance the equation so that we can rebuild as quickly as we wear and tear.
Yeah.
So for that, we teach people to not wear and tear as fast. So take the steps when you have to. But if you don't have to, take the elevator and the escalator. And don't be using your knees. Save them for the tennis court and the ski slope and the stairs you need to use. Stop using them where you don't need them.
Makes sense.
Still walk because that's great exercise, but don't do as many steps. Second, there's a nutrient that reduces wear and tear that you can look up. It's called niacinamide. 3 is, how do you increase your body's ability to grow cartilage? You do that with nutrients that promote joint healing. And one of them is glucosamine. And glucosamine works well taken by mouth for knees. But if you want to help any other joint in the body, from your jaw to your big toe, the glucosamine has to go through skin and be made in a cream, or it has to go with a needle and be injected. So for years, we have prescribed a glucosamine cream that's made by a compounding pharmacist, and that's the first aid for joints. And if we can balance wear and tear with your body's ability to rebuild and even get a little bit of a head before we do anything else, you'll already have improvement in the joint and know that you have the option or opportunity to win. From there, we can inject platelet-rich plasma to grow cartilage faster. Glucosamine will also promote growth of cartilage. And we can, there's research showing various stem cell procedures work really, really well, whether we use your abdominal fat, your bone marrow, or these agents that we can now order that get sent to us that come from placenta and umbilical cord donors. And so now we have tremendous ability to regenerate cartilage and joints. Hips are difficult to save. We lose very few knees. Most of this turns out to be how much motion do you still have in that joint. If you can totally straighten your knee and you can bend it more than 90 or 100 degrees, there is no way your joint can possibly be bone on bone.
That makes sense.
You can be bone on bone where you can't move, but it only takes 2 or 3 cell layers of thickness cartilage for a joint to be able to move pain-free. You'll never see that on an x-ray. So it'll look bone on bone, but it's not. So if you can still move your knee, totally straighten, and bend to 90 or 100 degrees, and you want to try to save your knee, there's a good chance you can. And if you can bend it most all the way up to where you can rest your heel almost to your buttock, there's no way you should be getting a new knee unless everything, it's too loose and it can't hold you. I've seen very few knees that can't be restored.
You said too loose and can't hold you. We only have a couple minutes, and I want to hear what you mean by that.
I can imagine that if the ligaments are so loose that your knee is so unstable that you can't even wear a brace to hold it. I can imagine that there's possibly someone bad enough that even though they can move their knee, this procedure is not going to work. But for the vast majority of people who have joint problems and joint issues, there's so much that can be done to be helpful that's worth really looking up these days. There's information all over the internet. There's some on our website also. And we do these procedures in all of the offices where we work. People need to know that they can go to our website and download the Do Not Eat list. They can also go to our website and look at the book and the rubber ball that goes with it and start to learn about fascia and learn how to make their own pain go away. I assure you that ball will become your very best friend. It happens all the time. There's enough in there to learn how to do this, and everybody should know that there's so much to do. If you were, if you cut your finger, what are you going to do? Hold it up in the air and watch the blood drip down your arm? Take some ibuprofen and wait till tomorrow? See how it is tomorrow, call the doctor and decide what to do with it? No, you're going to put your finger right on the other finger and stop the blood right away. That's not even a thought.
Right.
But what happens when your shoulder hurts? You're going to go home, put some ice on it. You're going to take some Motrin, see how it is in the morning, maybe decide what to do tomorrow. Absolutely not. You take out your rubber ball. You find the knot in your muscle that tightened when you made the pain. You shut that knot down with your rubber ball, just like you would put your finger on the bleeding to stop it, and you make that pain go away right now. That's what this book teaches.
When this, it helps when the strings get tied in knots.
Correct.
That makes sense.
That's all the pain in our body comes from our ability. I would really believe maybe almost all the pain in our body comes from our ability to tell what our strings are doing and the nerves in between these strings of fascia. And that system becomes the antenna for our brain to know what its periphery is doing.
Mm.
How do you know your bladder got full? As it got full, the walls got stretched. The nerve endings in between the fascia strings that hold your bladder wall together got more pressure. Your brain defines that as bladder distension and says, it's time for you to go to the restroom. Or it's too late to go to the restroom.
Find a spot now.
All these sensations come from that interaction of your nervous system. Start thinking of pain and discomfort that way, and all of a sudden you can realize, all I need to do is heal that, and I can make all this better. And absolutely. And when you push on that knot with the rubber ball, your pain will be better until the knot tightens back up, and then you can push on it again.
Yeah, tightens back up implies like re-injured.
It also implies that you ate food that glued you back together again.
Oh, gotcha. Like it wouldn't just tighten up like for no reason. It has to be instigated to tighten back up.
Usually, yes.
Yeah. Okay. Usually.
Because we've been able to get bodies to let go and not tighten back up. And we've been able to get bodies to get rid of the inflammatory reaction from what's going on and find that you can be tight and not hurt, which is amazing.
Yeah. Wow.
That tightness does not have to be pain. If you squeeze on your shoulder traps and they're really, really tender, that's an inflammatory food reaction. They shouldn't be that tender. You need to stop eating something you're eating.
Interesting.
Yeah.
Two things. Can you tell me your website one more time?
www.blackmanhealthandwellness.com. We're on Facebook. We have a Twitter feed. We have an Instagram page, and we have a YouTube page with some really awesome videos that you could go to and see to get more information about the things we've just spoken to learn a little bit about carpal tunnel syndrome. Sign on, become a member of or a subscriber of our YouTube page. You'll get updates and what we produce on a regular basis. I've just also started doing a weekly webinar that's real interesting to see. That'll come up on our YouTube page too. So yeah, please sign on and learn as much about this. This is all about helping people get out of pain, helping people make this transformation that they need to make, knowing that you don't have to live and suffer. You can survive, you can thrive, you can change your life.
Yeah, that sounds great. One last thing. Can you tell me those 4 things: where we feel pain isn't where pain originates, the Blatman method of pain CSI you mentioned? Those 4
Rule
things.
number 1,
from people?
You can't believe that where you think you hurt is where the pain comes from.
Okay.
Your headache doesn't come from your head. You can't believe what the pain feels like and think that's really different, because your body can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, and pain.
Okay.
Rule number 3, what you can totally believe, almost always, is that where specifically you are tender, millimeter by millimeter, is where your fascia that holds you together is tied in a knot, or where the fascia that holds you together is injured. And rule number 4, the places that are specifically most tender, as you examine with rule number 3, usually generate most of the pain you think from rule number 1 that you feel.
Wow.
So that in rule number 5, if we can detect these injuries, find them, and get your body to heal the ones that are most tender, we will most often together have the opportunity to watch most of your pain go away.
Oof. That's fantastic.
That is how our biology really works. That's what really needs to happen to make pain go away.
Wow.
Then you don't have to make the nerve numb. You don't have to kill the nerve. You don't have to kill the muscle. You don't have to make the brain stupid. And while we're at it, just for a moment, let's talk about the entire class of NSAID medications. Advil, Motrin, Nuprin, ibuprofen, every single one of them, they all cause heart attacks. And a recent article says that naproxen causes heart attacks increased with only 1 week of use. They all cause injury to your kidneys. They all cause injury to your intestines, causing ulcers that make you take drugs for ulcer disease. And they all stop or slow down your body's ability to regenerate cartilage in every joint, every minute of every day. So the very drugs that we take over the counter for pain and joint disability and dysfunction only make our bodies worse. There has to be another way. Let's suggest that people look at this way, because this way works a whole lot better. This way is a whole lot more fun. This way gets you out of pain and doesn't do anything to destroy and hurt your body in the process.
Wow. Dad, Dr. Hal Blatman, thank you so much for taking the time this morning to be on this podcast with me and do this lengthy conversation. You've explained a lot of this to me before, but it's so good to hear it in this package. And I have so many more questions for you, actually, including that what you've described to me briefly in what you call the P shot, as well as other micro myofascial release techniques that you've helped support me through to help me through my healing efforts. But that's where we got to wrap it up for today. Thank you so much, and I'll talk to you soon.
Well, Josh, thank you very much for having me on the show, and I really hope that what we're doing together and what we do in our future helps so many people.
All right. Thanks, Dad. Talk to you soon.
Have a wonderful day.
You
Bye
too.
now.
Bye.